Hello, everyone, and welcome. My name is Ayşenur Balcıyapalak, and I work as an assistant professor at Istanbul Medipol University School of Medicine. I'll be moderating today's session. This webinar is one of the several events organized by the Society for Public Health, Thinking and Innovation. In short, we call it HADI. This webinar is being organized as part of the European Public Health Week 2025. To briefly introduce HADI, it is an independent professional association made up of public health researchers and professionals based in Türkiye. Today's daily theme is Next Generation. The title of this session is Trend in Public Health Thesis in Türkiye, a Half-Century Perspective. Our speaker is Abdullah Uçar, and I'd like to briefly share his biography. In 2011, he graduated from Istanbul Faculty of Medicine. He worked as a physician for 11 years, and Dr. Uçar completed his PhD in public health in Istanbul University. Since 2022, he has been working as an assistant professor at Sakarya University Faculty of Medicine, Department of Public Health. Between 2022 and 2024, he worked as Vice Dean responsible for education in the same institution. Before we start the presentation, this session is scheduled for 1 hour. I want to make you remember this, and I'd like to remind you that the session is being recorded. We will answer questions at the end of the presentation, but please feel free to write your questions and comments in the Q&A session. You will see it at the top of the right part of your screen. Dear Dr. Uçar, the floor is yours.
Wait a minute. Yes. Hi everyone. Hello. Thank you for your kind presentation and introduction, Ayşenur. Hello everyone, good afternoon. I'm Abdullah Uçar, and I will present this presentation, the bibliometrics of the postgraduate public health thesis in Turkey. Today, we will talk about the bibliometrical analysis about this thesis through 5 decades. So let's start, but before it, let me to be sure if you see the presentation and do you hear me, Ayşenur? Okay, there's no problem.
Yes, we can hear you and see your screen.
Okay, I'm starting. Here, let's start with what the motivation was for us at this study. The motivation was an article of the Nature, the Nature journal, at the 115th anniversary of the Nature. Nature published an article, A Century and a Half of Research and Discovery, and they made a citation network, and it was so grateful study. It was a state-of-art level in public bibliometric analysis, and it was the citation network of the articles and pioneering papers during this 150 years. And you can achieve it, reach it at the Nature's website. And it was our motivation, and our focus idea was the trends and topic relationships in public health can also be mapped, like how nature do it. But according to the Nature, of course, we are amateurs, not professionals at data science maybe, but we can make a similar one. And our second focus idea, to make visible the gaps in the field. These gaps can become visible. Our scientific efforts can be distributed in a balanced way to our scientific needs. And where should we start? This thesis publishing in Turkey, the postgraduate thesis, master's thesis, PhDs and specialization thesis in Turkey is not included in the international indexes, unfortunately. This information needs to be visible and achievable by international scientific community. So new researchers, especially young professionals in the dissertation process, should be able to address neglected or emerging areas instead of the overstudied topics. And longitudinal monitoring of public health research can become navigatable for researchers, further research. We searched for previous studies before us, and we find these studies was horizon opening, okay, but they were so limited. We reached in Turkish literature 2 studies were reached, which had studied on the Turkish thesis conducted in Turkey, and they were cross-sectional and had a narrow scope. And time periods were so narrow, and public health subtopics scope is limited, and the relationship network between topics is not examined. This is the most important point. And the trend analysis over a wide period of time was neglected. So we decided to make a study which study on this wide period of time trend analysis and this co-occurrence network between subjects, topics in the field of public health in Turkey. We wanted to see the gaps, especially in neglected areas. And we conducted 2 sub-studies at this study. The first one, we need the topic list because we will multi-label the thesis. And so we need this topic list. Topics in the textbooks in the field of public health were collected and categorized in topic pool. And after that, we use this pool and categorize it. And we use them with the at the multi-labeling and analyzing of the thesis. 5 reference textbooks examined for the subject distribution. The first one is the Nusret Fişek's textbook, Introduction to Public Health, and Çağatay Güler, Basic Public Health, published from the Hacettepe. And Zafer Öz textbook, Public Health Theories and Applications, published recently. And the Wallace textbook, Public Health and Preventive Medicine textbook, and the Oxford's book, the textbook of Global Public Health. In this 5 books, we examined the subtopics of the public health. And we collected them. After them, we clustered them. I don't say the classified, because especially I say the cluster, because classifying is not coming from the data on. You made classes before the study and you put the topics on the classes, but this study is not based on the predefined classes. This study builds on the clusters, namely, these clusters will come from the subtopics, and we pulled them. After that, we collected them at the main subjects. As you see here, these are, for example, a topic war, bioterrorism, emergencies, is collected under the emergency situations and disasters. For example, health education, health literacy, health communication is collected under the health promotion. And tobacco, alcohol use, technology, collected under the dependence main subject. And these main subjects are clustered again because some of them are similar about to be a main topic, and the others were similar about methodological science. For example, health economy. Health economy looks like a methodological science. You can use health economy as a tool, and you can apply this tool to all of these main areas. And another one, for example, health promotion. You can use a health promotion tool for all of these main areas. So we need to categorize these 32 subtopics in 3 main subject areas. The main subjects of the public health, the methodological subjects of the public health, and the emerging topics like violence, global health, disadvantaged groups, dependence, rational use of medicines. This is a novel side of our study. We didn't see like this classification, clustering, and we would be pleased if there's criticism about this. We should improve this area. We should think on the classification of the subtopics of the public health. Now we will apply these topics to the thesis. So which thesis we include? We included the thesis published between the 1970s to 2022. And thesis indexed at National Thesis Center of the Turkish Council of Higher Education. This is a center which all the theses being archived and published, not as original article or journal publishing. It's an archive, and the raw material of the thesis are listed in this center. And the thesis conducted in public health departments of medical faculties, because out of the public health departments, some theses are labeled in this center as public health thesis, but we included this public health department of medical faculties thesis. At the level of master's, specialization, and PhD thesis, you know PhD, and maybe let's make a little explanation about the specialization thesis. In Turkey, after graduation from the medical faculty, you are having a specialization exam. After that, you are having a public health specialization educational period. After that, before graduation, you have to write a thesis. We say this thesis, it's not any PhD, it's a specialization thesis. Master thesis, as you know. And we included 2,623 theses in our study. Let me to show you a little example. Our analysis have 2 dimensions. The qualitative dimension is the multi-leveling of the thesis. For example, let's look at this thesis. There's a test here. Method study in determining the health levels of provinces in Turkey. We coded this scale development. We didn't make second code or third code. But this thesis factors affecting the knowledge and behavior of rural migrants to different parts of Istanbul regarding health and disease. We coded this thesis, disadvantaged groups and health promotion. And the other effects of education on smoking and alcohol in adolescents. The education means this is a health promotion study. Smoking and alcohol related belongs to the dependence subject, and adolescent keyword related with the adolescent health. So this thesis have 3 codes, but this one have 1, and this one has 2. This is the qualitative dimension of this study, not just the bibliometrical study. generally, in bibliometrical studies don't include the intervention of the researcher to the data. Bibliometrical study generally works with the metadata of the research. But we made an intervention here. We made a qualitative dimension. Like it looks like content analysis. It's so similar to content analysis in qualitative work. And bibliometric side, the analysis of codes and other metadata with bibliometrical methods and visualizations. And we made this open access online platform, and we named our group team Eureka, thanks to the Archimedes for this kind word. We named ourselves Eureka, and we publish our studies results here interactively. You can access to. Let's look at the results. Which universities were most productive? If we include the all thesis, master, PhD, and specialization, the number one is Istanbul, the second is Hacettepe, Erciyes, 9 Eylül, and Gazi universities. But just if you just include the PhD and specialty thesis, the first one, Istanbul 2, Hacettepe is the second, but 9 Eylül is third. Erciyes is going down at ranking. Why? Because it might be because of the master thesis is so much in Erciyes University, Ege, and Gazi. As you know, as you see here, this 5 or 6 university is the leading universities about publishing public health thesis. This graph shows us the whole list of the subtopics and their frequencies. This is a total graph during the 50 years at the total. And as you see here, the number one is occupational safety and health. The second, non-communicable diseases, health promotion, nutrition. But we need to see the trends. Most studied topics in main topics, occupational health, non-communicable diseases, and nutrition. As methodological content consist of public health promotion, social determinants of health, and scale development. And the emerging side, dependence, disadvantaged groups, and violence is the leading topics, as you see here in the graph as yellow, blue, and turquoise. Let's see this frequency table during time. I'd be pleased if you let me to show you this dynamic graphics. Let's go to the graphic. Maybe we can do like this. Wait, please. Yeah, here. Yes. We made a dynamic graph, as you see here. It's starting from the 1980s, and it's going to the 2022. As the years passed, you see the frequency list of the topics, the rankings of the topics. At the beginning of the 2000s, you see here the reproductive health, healthcare management is leading, health promotion is here, occupational safety and health is going up. And maybe you will see now a public mental health going up too. Nutrition is going up here. Yeah. This is the last cumulative, with cumulative numbers. This is the last photo. 2022 at the year. Yes. Let's turn to the presentation. Thank you for your time. Let's look at the results about trends. We made an interactive trend graphic, and we asked about which areas are most increased and which areas are most decreased. Here, the increased trends are non-communicable diseases, as you see at the graph. So occupational health and extraordinary situations and disasters are increasing trends, and decreasing trends are these ones: reproductive health, mother-child health, and healthcare management. I will ask you to let me again to show you this interactive graph. Here, this is the graph. You can choose the main category here. If you want to search for main categories and methodological categories, the trends of the methodological categories and emerging categories here. Let's read one of them. For example, dependence, a subtopic, emerging topic. This topic percentage among the all theses at that time. For example, at the 1980s to 1989s, the 3.09% of the thesis was related with the dependence. You see the word slope here. The slope means the linear regression line slope through the 5 decades, as you see here. Yes, let's turn to the presentation again. And here, the last one, the last part of our study was co-occurrence analysis. Co-occurrence means to occur at the same time with something. Co-occurrence of the keywords, for example, co-occurrence of the same subjects, to be in relationship. The most co-studied topics here is nutrition and health improvement. This is the real graph, as you see here. This is the real graph. Nutrition and health improvement relation. Here is the nutrition, and here is the health improvement, and you see this line. It's a bold line. And the second one, non-communicable diseases and health improvement. The second bold line you see here, starting as red from here to gray. And the other one, mother and child health to nutrition. Look at it. This is the mother and child health and nutrition. Let's look at this graph, and then I will talk on the neglected relations. Let's see. This is the interactive graph of our co-occurrence analysis. In this graph, for example, I'm searching about the relationship of nutrition with other topics. I'm coming here and I look at the relationship map, and when I click, I saw the number of the theses conducted related to that topic. This is the nutrition relation map. And the other one, public health public mental health map, for example. The most studied, co-studied topic is occupational safety and health. This is interesting. For example, let's ask a question with which field the health improvement has applied so much. When we click this, we saw the co-studied areas. For example, violence. Here there's a violence category. Let's look at the violence. The violence is most studied with public mental health, for example. And let's talk about the neglected areas now. For example, with violence, the health improvement is studied just one. We must ask, we should ask about if we are enough if you're enough to study on violence with health improvement tools. And for example, let's look at another tool. For example, informatics. Which files has applied informatics or co-studied with informatics so much? You see the map now. Let's close this here. Pardon, we have to close the map at first. Yes, informatics, yeah. Here is the informatics map. We co-studied the health informatics with healthcare management and dependence, for example, and non-communicable diseases. This is the co-occurrence map, and this map you can use use this graph. You can search and discover the neglected areas or overused or overstudied areas, and the relationship of the subtopics of the public health. For example, health improvement, violence, health economics, and rational use of antibiotics, nutrition and public health informatics. These areas are neglected, according to us. As we come to conclusion, our study sheds light on 50 years of public health thesis in Turkey. There is no agreed list of public health files of study. The clustering study necessitates that the field of public health philosophy. We need extra classifications, clusterings. If the clustering is the starting point of the thinking, as the pioneer philosopher Aristotle made at the book of Organon, the categorization of the sciences, categorization of the concepts, words, to make concepts, to produce concepts, are the basis of the scientific thinking and scientific philosophy. Our study presents the frequency of topics, trending and declining topics, and the relationship map of topics with each other. The study results are presented in online, interactive, open access platform, and you can navigate it for further research. And the last words, bibliometric analysis are studies that make visible in which directions and which dynamics our scientific space is expanding. The use of this method in public health points to new horizons for pioneers in the field, and maps should be created for the optimum distribution of our scientific energy, scientific efforts across fields in favor of health. Thank you for your kind attention until here. Thank you for your time. Yes, here is the references, the last slide.
Okay, many thanks to Dr. Uçar for the presentation. Now I will share the questions from our participants, but to remind again to the participants, please feel free to write your questions and the comments in the Q&A section above, right above your screen. The first question is, thank you for your presentation. The noticeable decline in theses related to healthcare management particularly caught my attention. How can we explain this trend? Also, have you examined whether the selection of thesis topics has been influenced by major public health events in the country? This is our first question.
I understand the first part of the question, but it was hard to understand the second part.
I can repeat you after you after you answer the first one. I can repeat the second part.
Okay. The question was, as I understand, what is the meaning of this trends in the public health?
The healthcare noticeable decline in theses related to healthcare management. Particularly caught my attention. How can we explain this trend?
Actually, it was surprising for me too, because Turkey is going up on healthcare management and making lots of revolutionary management interventions. And why is the healthcare management is going decline? I especially looked at this decline, and I found that this decline caused because of the first part of the how can I say it? The first part of the graph. The first part is going down, after that going up. From the 1990s, it's going up. The trend is going up. But if we include the 70s and 80s, the trend looks like it's declining. It's a bias, as I think. It's if we use linear regression, maybe it can be biased. Maybe we must use logistic logarithmic regressions or quadratic regressions.
Okay, thank you. Then I will go.
This was a good question. The owner of this question is catched me.
Okay, thank you to our participants. We cannot see his or her name.
Okay.
So I will continue with the second part. Also, have you examined whether the selection of thesis topics has been influenced by major public health events in the country?
Yeah, we can say, for example, about the emergency health, the disaster health. For example, in Turkey, we had earthquakes. A few years ago, we had Maraş earthquake, and recent months, we had Istanbul earthquake. And as you see here, at the trends, the most increasing trend, one of the most increasing trend was disaster health in public health.
Yeah.
For example, in Turkey, we had lots of investment on mother and child health. It was so big problem in 90s in Turkey. We made lots of investments, and okay, it's a problem now, but it's not bigger problem. It's not big problem as 90s now. So the thesis is possibly focusing on the not directly to the mother and child health, but the health improvement side of it, as I think. Thank you.
Thank you. Then the second question. This was the second part of first question. We have another question too. What areas do you think we should expect to see more research on in the future? And there are also this question is continue, but first you can answer this part, and then I can continue.
Okay, thank you. Thank you for your facilitating. I think, according to me, according to me, we should focus on the most neglected areas. We shouldn't go to the populist science, and the science is going somewhere, but is it because of the popularism or because of the need? We have to focus on the need of the society, need of the health, the community health. And so in the future, I don't know where will this health studies will go, but I hope they will focus on the real needs. For example,
Actually,
as you
okay.
as I show you, the violence and the health improvement is so weak. Why we don't study about this? It's a neglected area. Or why the public health information technologies don't be studied about mother and child health? And it's so weak. We can study in the terms of multidisciplinarity and interdisciplinarity. These areas will be leading areas, as I think.
Okay, thank you. Actually, you already answered the second part of the question, because it was asking what are your recommendations for the next generation regarding public health research, especially when it comes to choosing thesis topic. So you already
maybe extra. I can say this. We shouldn't neglect the meta science of the public health. This bibliometrical study was a part of this meta science. It's a small example, but we shouldn't neglect this area. We are making a science, okay, but where this science is going. And so we must monitor ourselves. We must monitor the scientific expansion of the files. And we always consider the needs of the humanity, needs of world, needs our country, needs our own community.
Thank you for your answer.
You're welcome.
Actually, I have a question. I know you didn't present at this part, but maybe you know it. Did you collect or analyze the study type of the thesis? I don't know, but as a public health specialist, I know that we don't have enough time, like PhD students, to have a thesis. So I wonder if this has an effect on that. Did you ever look for the study types?
We didn't look for study types because on study types, some articles focused on the study types, but we didn't focus on this. Our focus was the topics. We wanted to classify them, but I would be pleased, and we would be pleased to study in collaboration about this topic. The most hardly part of this study was this: the bibliometrical studies are conducted generally from the Web of Science database or PubMed databases, Scopus databases. These databases are so very well structured.
Yes.
But we are taking.
You can have the data.
Yeah, of course. We are taking the raw data from the National Thesis Center, and we are analyzing it. Also, it is so hard, this raw data, to use this data on the VOSweaver, one of the most popular analyzing programs about bibliometric analysis, VOSweaver. VOSweaver is closed about this data. You can't upload your work. You have to structure it so much. You have to work on your data. The data preparation is so hard. So to work with international indexed databases, it is not so much hard, but to study with this data in the shadow of the indexes. They are not indexed in the international indexes. Is not so easy. So we have so limited energy, and we focused on the classification of the topics.
Thank you. Actually, if you didn't mention this part of the study, I would never imagine it could be that much hard. And the structured part, I could guess, but the uploading part of I
Data.
don't remember the name of the program, but I couldn't imagine it could be the VOSweaver. Okay. I couldn't imagine to upload the data there would be that much harder.
We succeeded. We succeeded, but we consumed so much effort.
Yeah.
It was hard.
Good for you. I think it should be a really good experience for you and the Eureka team.
Of course. To discover something is so nice feeling. To discover something about science. To make meta science is so horizon broadening study field. I advise all the young professionals.
Thank you. Thank you for your presentation.
I thank you for your time.
If you don't have any other thing to add, I will close the session.
Thank you, and thanks to the thanks to Sabanur and the Hadi organization for conducting this presentation, and I thank especially to the audience who give time here. Thanks a lot.
Yeah. Then, as we close, I thank to our speaker and to our attendees too. And for the upcoming events, you can follow our website, Hadi website, and the UFA website. The upcoming event will be the last one for this Public Health Week. It will be held today at 5 p.m. local time in Türkiye, with the same theme, which is next generation. And this event will be in Turkish and will be presented by Dr. Şeyma Halaç. Goodbye for now and take care.